I'm Dr. Divpreet Sacha, a GP with special interests in women's health and occupational health. Today, let's talk about a common myth surrounding postpartum recovery. We've all seen posts of new mothers snapping back just weeks after giving birth, running, lifting weights, looking like nothing happened. But as a doctor, I want to talk about why rushing recovery isn't just unrealistic, it can actually be harmful. Pregnancy and childbirth put enormous strain on your body, and there are 4 key areas that need time to recover before increasing your activity level. During pregnancy, your abdominal muscles stretch significantly to make room for your baby. After birth, they need time to realign. Jumping into crunches or weightlifting too soon can slow this healing process and lead to diastasis recti, where the muscles remain separated. In some cases, this can also increase the risk of a hernia. If you had a vaginal birth, your pelvic floor has been under a lot of stress. High-impact exercises like running or jumping too soon can increase your risk of pelvic organ prolapse, where the bladder, uterus, or rectum shift due to weakened support. Hormones like relaxin loosen your joints during pregnancy to prepare for birth, but they stay in your system for months afterwards. This means your joints remain unstable, making you more prone to knee, hip, or lower back injuries if you return to high-impact workouts too soon. If you had a C-section, remember, it is major surgery. Even if your incision looks healed on the outside, the deeper tissues need time to recover. Exercising too soon can cause trauma to your scar, slow down healing, or even lead to wound infections. If you notice your scar feeling sore, looking raw, or leaking fluid after activity, see a doctor as soon as possible. One key sign is lochia, the post-birth bleeding. This naturally reduces over time, but if you notice it suddenly increases after exercise, it could mean that you're overdoing it and need to scale back. Other red flags include pelvic pain, increased scar discomfort, or feeling of heaviness in your lower abdomen. But here is the thing, waiting 6 weeks to do nothing, then suddenly jumping into your old workouts is not the answer either. Movement is important, but it has to be the right kind. If you had a straightforward birth, you can start with gentle pelvic floor exercises, deep core activation, breath work, and walking as soon as you feel ready. If you had a C-section or a complicated delivery, recovery might take longer, so listening to your body is key. As part of your postnatal check, as a doctor, I would assess a few key areas before increasing your activity level. Stitches and wound healing. If you had a C-section or episiotomy, check that your stitches are fully healed with no pain, infection, or delayed recovery. Pelvic floor health. Watch for urine leakage when coughing, sneezing, or exercising, or a heavy dragging sensation in your vagina. These could signal pelvic floor issues. Postpartum bleeding. Lochia should gradually decrease. If bleeding increases after activity, you may be doing too much too soon. Recovery isn't about bouncing back. It's about healing properly. Your body just did something incredible, and there's no deadline to get back to anything. If something feels off, or you're struggling with pain or weakness, don't push through. Get checked by a doctor or specialist. Your health comes first. Have a burning question? Leave it in the comments or get in touch with us directly through Instagram messaging.